That little cough your dog or cat does, it can be so easy to brush off, right?
Yeah, definitely.
Maybe you think they're just clearing their throat or, trying to hack up a hairball.
It happens all the time.
But what happens when that cough just sticks around week after week?
hmm
That's the puzzle we're tackling today. Chronic bronchitis in dogs and cats.
It's a common one, unfortunately.
Our goal in this deep dive is to really get under the skin of this condition, what it is, what might be setting it off, how vets figure it out, and, most importantly, what we can actually do to help our furry friends breathe easier.
Absolutely. Providing some clarity.
We've got some detailed veterinary information here to guide us. All right, let's unpack this seemingly simple issue of a cough that just won't quit and dive into the complexities of chronic bronchitis in our animal companions.
Sounds good. So where should we start? Maybe with the definition.
Yeah, let's nail that down first. What exactly is chronic bronchitis?
Okay, so when we talk about chronic bronchitis, the key thing is a cough that hangs around for more than 2 months.
2 months, okay.
And this is critical. This cough isn't being caused by something else specific. We're talking things like cancer, heart failure, pneumonia, or a direct infection of the lower airways. Those need to be ruled out first.
Right, it's its own thing.
Exactly. And what's really important to understand, maybe a little sobering, is that this is often a condition that creeps up slowly. It's progressive. And some of the changes that happen in their airways, well, they can be partly irreversible.
Partly irreversible. That sounds pretty significant. Why is that detail so important for us pet owners to really get?
Well, it fundamentally shifts how we approach treatment.
Yeah.
We're often not aiming for a complete cure, like making the problem vanish entirely.
Okay. So it's more about management.
Precisely. The focus becomes managing the condition to give our pets the best possible quality of life.
Right.
Because the physical structure of their airways has already changed to some degree, our efforts are about calming the inflammation that's there and trying to slow down any further damage.
Right. Protecting what's still working well.
Exactly. So, unlike some illnesses where you expect a full recovery, here it's really about strategic long-term management. It's a different mindset for owners.
Okay. That makes a lot of sense. So what's actually going on inside their bodies physiologically that leads to this chronic coughing? What's the mechanism?
The current thinking is that it's usually driven by ongoing inflammation deep down in the airways.
Inflammation. Okay.
Yeah. But the tricky part is that pinning down one single thing that kicks off and keeps that inflammation going is often really difficult. We don't always find a specific cause. We suspect it's a response to some kind of persistent irritation of the windpipe, the trachea, and the larger airways, the bronchi. And this constant irritation sets off a whole cascade of changes in the lining and even the deeper tissues of these airways.
Persistent irritation, like what sort of things are we talking about?
It could be a whole range of things, and we definitely dig into those more when we talk risk factors later. But basically, this continuous annoyance leads to some key physiological changes.
Okay, like what?
Well, you see the inflammation itself, obviously. Swelling of the airway walls. And a real hallmark of chronic bronchitis is the body making too much mucus, and it's often really thick, sticky mucus.
Ugh, that sounds unpleasant.
It is. Imagine their airways are constantly trying to defend themselves from this irritation by pumping out more and thicker gunk. It's almost like having a permanent runny nose, but deep inside their lungs.
Right.
Now, in cases that have been going on for a long time or are particularly severe, this can unfortunately lead to other problems, like increased resistance in the lungs, making it harder for them to breathe out. This is especially noticeable in cats.
Harder to exhale. Interesting.
Yeah. And in dogs, we sometimes see more serious complications develop down the line. Things like bronchial. Think of it like the airway walls getting weak and floppy.
Oh, wow.
And also bronchiectasis. That's where the airways become abnormally widened, and they can actually trap that thick mucus, making infections more likely.
So it sounds like the airways are just constantly aggravated, almost under siege, leading to this ongoing reaction and all that gunk buildup.
That's a great way to put it, yeah. And this constant state of inflammation and mucus production, it doesn't always just stay confined to the lungs. It can have knock-on effects elsewhere in the body, too.
So it's not just about the coughing, then. What other systems can get dragged into this?
Well, the primary impact is definitely the respiratory system, of course. But we can also see effects on the cardiovascular system. The heart and lungs are closely linked.
Okay, how so?
Over time, especially in severe chronic cases, some animals can develop pulmonary hypertension. That's high blood pressure, specifically in the arteries within the lungs.
Right. High pressure in the lungs.
And that increased pressure puts a strain on the heart. It can sometimes lead to a condition called cor pulmonale. That's where the right side of the heart becomes enlarged and weakened because it has to work so much harder to pump blood through those high-resistance lungs.
Wow, so a lung problem can actually damage the heart.
It can, yes. And less frequently, we might even see signs related to the nervous system. Things like syncope, which is basically fainting spells.
The fainting from coughing.
Yeah, it usually happens during or right after a really severe coughing fit. The intense coughing can briefly reduce blood flow to the brain, causing them to pass out for a moment.
Goodness. Okay, that cardiovascular link is definitely surprising. What's the main takeaway for pet owners there?
I think the key message is that a persistent cough isn't just a minor annoyance. It's a sign that something significant might be going on, and it can have broader implications for their overall health, potentially straining their heart and lungs over the long haul.
Right. It really drives home why we need to take that chronic cough seriously and work with a vet.
Exactly. Early and consistent management is key.
Okay, so who typically gets chronic bronchitis? Are certain pets more prone?
It's actually a pretty common condition. We see it in both dogs and cats all around the world. Now, looking at breeds, we do see some tendencies. In dogs, interestingly, both small and large breeds can be affected. But Cocker Spaniels seem to pop up more often with that complication, bronchiectasis, usually after they've had chronic bronchitis for a while.
Cocker Spaniels.
What?
Okay, what about cats?
In cats, Siamese and domestic shorthair seem to be diagnosed more frequently. But honestly, it's important to remember that chronic bronchitis can happen in almost any breed.
Got it. And what about age?
It tends to be more common in middle-aged and older animals.
So it's something we should maybe be more aware of as our pets get older, regardless of their breed.
That's exactly right. As they age, their susceptibility to various chronic conditions, including this one, does tend to go up.
Okay, so we know what it is, who it affects. Let's talk about spotting the signs. What might we, as pet owners, actually notice at home?
The absolute classic sign, the hallmark, is that cough that just won't go away. Remember, lasting more than 2 months.
Right, the persistent cough.
Owners often describe it as harsh, maybe dry sounding. And one thing that's really common and often tricks owners up is the gagging that frequently follows the cough.
The gagging.
They'll cough, 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 and then make this retching sound like they're trying to bring something up. It can easily be mistaken for trying to vomit or, deal with a hairball, especially in cats.
Yeah, I can totally see how that would be confusing.
Absolutely. You might also notice your pet getting tired more easily during walks or playtime. That's exercise intolerance, maybe some difficulty breathing, or even wheezing sounds, especially common in cats.
Wheezing, okay.
And then in more severe cases, unfortunately, you might see their gums or tongue looking a bit bluish.
That's cyanosis, a sign they're not getting enough oxygen. Or even those fainting spells, the syncope that we mentioned earlier after intense coughing.
That gagging detail is so important. It's easy to think stomach, not lungs. So really paying attention to the type of cough and what happens with it seems crucial.
Definitely. Note the pattern, the sound, what happens afterwards. And what might a veterinarian find during their physical exam? What clues do they look for?
Well, often, despite the chronic cough, the pet seems otherwise pretty bright and alert. They usually don't have a fever.
Okay.
A key finding is often tracheal sensitivity. When the vet gently palpates or feels their windpipe, it often triggers a cough because the trachea is inflamed and irritable.
Ah, okay. Makes sense.
If there's disease affecting the smaller airways deeper down, the vet might notice what's called an expiratory abdominal push. That means the pet is actively using their belly muscles to help push air out even when they're just resting.
Using their abs to breathe out.
Right. They might also hear wheezing sounds, especially at the end of the exhale when listening with a stethoscope.
What else might they hear in the lungs?
They might hear generally louder than normal breath sounds, what we call increased bronchovesticular sounds, sometimes crackles, especially at the end of an inhale, and wheezing, as we mentioned. Oh, and sometimes there's a distinct sound, a loud snapping noise right at the very end of exhalation. That can suggest that some of the small airways are actually collapsing momentarily.
Wow, a snapping sound. And what about their heart rate? You mentioned the heart connection earlier.
Yeah, this is interesting. In dogs with chronic bronchitis, the resting heart rate is often normal or sometimes even a bit slower than usual.
Slower, even with a breathing problem.
Yes, and they might have a more pronounced sinus arrhythmia. That's the natural, normal variation in heart rate that happens when they breathe in and out. It becomes more obvious.
Okay.
And that finding the normal or slow rate with that prominent sinus arrhythmia is actually a really useful clue for vets. It helps differentiate it from something like congestive heart failure, which typically causes a fast heart rate in dogs.
Ah, I see. So the heart rate helps point towards lungs versus heart. What about cats?
In cats with chronic bronchitis, a faster heart rate is more possible, so it's a bit different there.
Got it. Anything else vets look for during the exam?
Yeah, obesity is very common in pets with chronic bronchitis, and that extra weight definitely makes breathing harder and can worsen inflammation.
Right, the weight factor again.
And in dogs, there's a known link between severe dental disease and problems in the lower airways. The idea is that bacteria from the mouth can get inhaled down into the lungs and contribute to the inflammation or cause secondary infections.
Dental disease affecting the lungs, that's incredible. It really highlights how interconnected everything is.
It really does. Something that seems like just a mouth issue can directly impact respiratory health. It's a real eye-opener.
Okay, so that point about the normal or slower heart rate in dogs being a key differentiator, why is that so important for vets in figuring things out?
It's super valuable because, like you said, conditions like congestive heart failure, which also cause coughing, typically make the heart beat faster as it struggles to compensate. So finding that normal or slow heart rate, especially with a pronounced sinus arrhythmia in a dog with a significant chronic cough, really helps the vet narrow things down. It steers them towards thinking primarily about a respiratory problem like bronchitis rather than immediately jumping to a heart conclusion.
That's a fantastic clinical insight. Okay, we've covered what it is, who gets it, the signs, but what actually causes chronic bronchitis? Is there usually a smoking gun?
You know, as we touched on, pinpointing one single specific cause often just isn't possible. It's usually not that simple.
So more complex then.
Yeah, it really seems to develop from that ongoing chronic inflammation within the airways. And this inflammation can be triggered or perpetuated by a whole bunch of different factors acting together. It's often multifactorial.
Okay, so if there isn't usually one specific trigger, what are some of the key risk factors that might make a pet more likely to develop it?
Long-term exposure to inhaled irritants is definitely a big one. Things that bother the airways day in, day out.
Like what kind of irritants are we talking about? Things in the house?
Exactly. Things like cigarette smoke are major culprits.
Yeah.
But also household dust, mold spores, strong perfumes, aerosol sprays like hairspray or air fresheners, even some cleaning product fumes. Anything airborne that can irritate sensitive airways over time. Things many homes have.
Absolutely. Obesity is another really significant risk factor. Carrying that extra weight puts mechanical strain on the chest and breathing, and fat tissue itself can actually promote inflammation throughout the body.
Right, the inflammation link with obesity.
Repeated bacterial infections in the airways can also contribute. Each infection causes damage and inflammation, potentially setting up a chronic cycle. And then there's that link we mentioned with dental disease or even issues with the larynx, the voice box. Bacteria from the mouth or throat can get aspirated, inhaled down into the lower airways, causing problems there.
Those inhaled irritants, it makes you think about the pet's environment. What are some of the most common household things owners should maybe try to minimize if they have a sensitive pet? Yeah, definitely things like avoiding smoking indoors is huge, limiting the use of strong scent perfumes, plug-in air fresheners, scented candles. Using HEPA filters in air purifiers or HVAC systems can help reduce dust and allergens. Regular cleaning to minimize dust mites. Being mindful of ventilation, especially when cooking or using cleaning products. It's about reducing that overall load of airborne particles they're breathing in.
That's really practical advice. Okay, so let's say we suspect our pet might have chronic bronchitis based on the signs and risk factors. What does the diagnostic process actually look like? How do vets confirm it?
Well, it can be a bit of a puzzle, like we said, because several other conditions cause very similar symptoms. Coughing is a common sign for many things.
Right.
So the big initial step is ruling out those other possibilities. We call these the differential diagnoses.
Okay, so what kind of conditions are on that list? What else mimics chronic bronchitis?
Well, things like bronchiectasis, that airway widening we mentioned, which can be a consequence of chronic bronchitis, but also presents similarly. There's another inflammatory lung condition called eosinophilic bronchopneumonopathy.
Okay.
We also have to consider things like an inhaled foreign body, maybe they inhaled a grass seed or something. Heartworm disease is a big one to rule out, various types of bacterial pneumonia, Even cancer, especially cancer that is spread, metastasized to the lungs, can cause coughing.
Right.
Lung parasites, a condition called pulmonary fibrosis, which is scarring of the lung tissue, and very importantly, congestive heart failure.
Right, heart failure keeps coming up. How do vets reliably tell the difference between chronic bronchitis and heart failure, especially since both cause coughing?
That's a really crucial distinction to make. As we discussed, that resting heart rate is often a big clue in dogs, usually fast with heart failure, often normal or slow with bronchitis.
Got it. The heart rate.
Also, imaging is key. Chest x-rays or radiographs will often show different things. With heart failure, you typically see an enlarged heart silhouette and signs of fluid buildup in or around the lungs. With chronic bronchitis, you're more likely to see changes in the airways themselves, like thickened bronchial walls, what we call donuts or tram lines.
Donuts and tram lines.
Yeah, they're terms vets use to describe how the thickened airway walls look on an x-ray when seen end-on donut or side-on tram lines. Sometimes an echocardiogram, an ultrasound of the heart, is needed to get a definitive look at the heart's structure and function and rule out primary heart disease.
Okay, that makes sense. Imaging is key. So beyond ruling out these other conditions, what specific tests help diagnose chronic bronchitis itself?
Routine blood work like a CVC, complete blood count, a biochemistry panel, and a urinalysis are usually run. They rarely give a definitive diagnosis of bronchitis on their own, but they can provide useful supporting information or point towards other issues.
Like what might they show?
For instance, we often see an elevated number of neutrophils, a type of white blood cell, which just indicates inflammation somewhere in the body. Sometimes we see an increase in another type of white cell, eosinophils, which might suggest parasites or an allergic component. In really severe chronic cases where the pet isn't getting enough oxygen, the body might produce more red blood cells to compensate, so we might see an elevated red cell count. And sometimes liver enzymes or bile acids can be mildly elevated, potentially due to passive congestion if the respiratory disease is severe enough to affect blood flow back to the heart.
Okay, so blood work gives clues, context, but isn't the main diagnostic tool here. What other lab tests might be done?
Definitely fecal exams to check for lungworms or other parasites that can cause coughing. And heartworm testing is absolutely essential.
Right, rule out parasites.
Pulse oximetry can give us a quick, non-invasive measure of oxygen saturation in the blood, seeing if it's low. For a more precise assessment, an arterial blood gas analysis measures the actual levels of oxygen and carbon dioxide in arterial blood. This is really helpful for understanding the severity of the respiratory compromise and also for tracking response to treatment.
Okay, blood gas analysis for severity. And what about those chest x-rays you mentioned? What specifically are vets looking for that suggests bronchitis?
On the chest radiographs, the most common findings, sort of in order of frequency, include that bronchial wall thickening. We talked about the donuts and tram lines.
Right.
We might also see what's called an interstitial pattern, which suggests inflammation or changes in the lung tissue itself between the airways and air sacs. In cats, sometimes we see a consolidation, like a denser area of lung, often in the right middle lung lobe. Occasionally, lung collapse or atelectasis can occur. And particularly in cats, we might see signs that the lungs are overinflated, hyperinflation, and the diaphragm might flatten because the lungs are pushing down on it.
Interesting differences between dogs and cats there. And beyond x-rays, is other imaging commonly used?
Yes, that echocardiogram, the heart ultrasound, is really important, mainly to definitively rule out underlying heart disease as the cause of the cough.
Okay.
It also allows us to assess the size and function of the right side of the heart, looking for signs of that core pulmonale we discussed, and Doppler echo can help estimate if there's pulmonary hypertension.
Got it. So echo for the heart check. Now, are there any specific procedures that are really considered key for diagnosing chronic bronchitis?
Absolutely. The most crucial diagnostic step is often evaluating the secretions, the mucus, from the lower airways.
Lower airways, not just the throat.
Exactly. Just swabbing the back of the throat isn't helpful for diagnosing bronchitis. We need samples from down where the problem is the trachea and bronchi.
Okay, how do you get those samples?
Typically through procedures like a tracheal wash, or more commonly now, bronchoalveolar lavage, or BL. This usually involves passing a sterile tube or a bronchoscope down into the airways and gently flushing a small amount of sterile saline solution in, then suctioning it back out to collect cells and secretions.
Okay, BAL. And what do you do with that fluid?
We send it off for analysis, primarily cytology, where we look at the types of cells under a microscope. With chronic bronchitis, we usually see lots of inflammatory cells, especially neutrophils. We also look carefully for any signs of bacteria, fungi, parasites, or even cancer cells.
So looking for inflammation and infection.
Right. And we also perform cultures on the fluid bacterial cultures, including tests for mycoplasma, which is a type of bacteria without a cell wall that can cause respiratory issues. If we do a BL, we can do quantitative cultures, which helps us tell the difference between just a few bacteria hanging out, colonization, versus a true active infection where the bacteria are multiplying and causing disease.
Ah, colonization versus infection. That's an important distinction.
It is, because we don't want to overuse antibiotics if there isn't a real infection. We might also do anaerobic cultures if we suspect those types of bacteria.
You mentioned a bronchoscope for the BAL. Is bronchoscopy itself useful?
Oh, absolutely. Bronchoscopy is often considered the preferred method if available. It involves using a small, flexible camera passed down into the airways.
A camera in the lungs.
Essentially, yes. It gives us a direct, magnified view of the inside of the trachea and bronchi. It's incredibly valuable.
What can you see with it?
We can directly visualize any structural changes, redness, swelling, excessive mucus, clear or pus-like, narrowing or widening of the airways. We can see if the lining looks bumpy or irregular. We can even watch how the airways function during breathing, looking for signs of collapse, like that floppy airway condition, tracheomalacia, or bronchomalacia.
Wow, real-time view.
Exactly. And it allows for very targeted sampling. We can take fluid samples, BAL, from specific lung lobes, or even tiny biopsy samples from the airway wall if needed. Plus, it helps identify those complications like airway collapse and bronchiectasis much more clearly than X-rays alone sometimes can.
And if biopsies are taken, what do those typically show in chronic bronchitis?
The histopathology, the microscopic examination of the tissue, usually shows signs of chronic inflammation. Lots of neutrophils, maybe other inflammatory cells too, and often evidence of fibrosis, which is basically scar tissue forming in the airway walls.
Scar tissue. So that ties back to the irreversible changes you mentioned earlier.
Precisely. That fibrosis is a marker of that permanent structural damage that contributes to the chronic nature of the condition.
Okay, so it really sounds like diagnosing chronic bronchitis isn't straightforward. It involves putting together the history, the exam findings, ruling out a whole bunch of other things using imaging, and then crucially getting those lower airway samples, ideally via bronchoscopy. It's a multifaceted investigation.
That's absolutely correct. It's detective work, carefully putting all the pieces of the puzzle together to arrive at the right diagnosis.
All right, so let's say we've gone through all that, and the diagnosis is chronic bronchitis. What happens next? What does treatment typically look like?
The standard approach is usually managing the pet at home as an outpatient. That's the most common scenario.
Okay.
However, if the pet is really struggling to breathe, needs supplemental oxygen, requires injectable medications for faster effect, or needs aerosol therapy like nebulization that's hard to do at home, then hospitalization might be necessary, at least initially. Also, if the pet just gets too stressed or anxious at home, sometimes being in the clinic for stabilization is better.
Right. What about supportive care, things owners can do at home?
Home nursing care plays a really big role. One helpful thing is saline nebulization, using a nebulizer machine to create a fine mist of sterile salt water for the pet to inhale.
Nebulization. How does that help?
It helps to hydrate and thin out that thick, sticky mucus in the airways, making it less viscous and hopefully easier for them to cough up and clear out.
Okay. Loosens the gunk.
Exactly. And that's often followed by something called chest physiotherapy, or coupage. This involves gently but firmly tapping on the pet's chest wall in specific areas and patterns.
Tapping on their chest?
Yeah, it sounds a bit strange, but the percussion helps to physically loosen the secretions that have been mobilized by the nebulization, encouraging them to move up and out of the smaller airways.
Interesting. Like clapping dust off a rug.
Kind of. And gentle, controlled exercise can also be beneficial. Just getting them moving can help stimulate coughing and clearing of secretions.
You mentioned exercise. What kind of activity level is generally recommended? We don't want to make the coughing worse.
That's the key balance. Moderate, controlled exercise like leash walks is usually good, as long as it doesn't trigger excessive coughing fits. If it does, you need to back off.
Right. Listen to the pet.
Absolutely. And it's really advisable to use a harness instead of a neck collar when walking them. You want to avoid any pressure on the trachea, which is already sensitive.
Good tip. Use a harness. Now, you've mentioned weight a few times. How big a deal is diet and weight management in these cases?
Oh, it's huge. Truly critical, especially for the many pets with chronic bronchitis who are overweight or obese.
Why is it so important?
Getting them down to a lean, healthy body weight can make a remarkable difference. It can significantly improve their blood oxygen levels, boost their energy and overall attitude, increase their ability to tolerate exercise, and often leads to a noticeable reduction in both the frequency and severity of their cough.
Wow, so weight loss alone can really impact the coughing.
Absolutely. It reduces the mechanical load in their chest, improves lung function, and reduces that systemic inflammation we talked about. It's a cornerstone of management for overweight patients.
That's really powerful motivation for owners. Now, looking long term, what are the most important things for us pet owners to understand about managing this condition? What's the reality?
The absolute most important thing to grasp is that chronic bronchitis is a condition we manage, not a disease we typically cure.
Manage, not cure.
Complete elimination of the cough. That's usually an unrealistic expectation. The goal isn't necessarily silence.
So what is the goal?
The focus is on consistent, ongoing, aggressive management to minimize the severity and frequency of the cough, improve their quality of life, and hopefully slow down the progression of the disease. This means sticking with the plan weight control if needed, being really diligent about avoiding those inhaled irritants we discussed, and giving medications consistently as prescribed. It's a multi-pronged approach, and commitment is key.
That makes sense. Setting realistic expectations. Are there ever surgical options involved?
Not usually for the bronchitis itself. There's no surgery to fix the inflamed airways directly. However, if the pet has concurrent severe dental disease, then addressing that surgically professional cleaning, extracting diseased teeth can be really important.
Why? How does dental surgery help the lungs?
By removing that source of chronic infection and inflammation in the mouth, you reduce the risk of bacteria constantly showering down into the lungs and causing secondary infections or worsening the existing inflammation.
Ah, removing the bacterial source. Got it. Okay, let's dive into the medications. What are the main types of drugs used?
Corticosteroids are really the cornerstone of medical management for most cases
Steroids. Why are they so important?
because they're very effective at reducing inflammation in the airways. Since inflammation is the core problem, calming that down directly tackles the issue and usually leads to a significant reduction in coughing, regardless of the initial trigger.
Okay.
They're generally indicated for cases where we've ruled out an active bacterial infection as the primary driver. Because it's a chronic condition, these steroids usually need to be given long-term. The goal is always to find the lowest effective dose that controls the symptoms, to minimize potential long-term side effects.
Right. Lowest effective dose. Are there different types?
Yes. For oral use, prednisolone is often preferred in cats, while prednisone or prednisolone are common in dogs. Usually, we start with a slightly higher dose to get the inflammation under control quickly, then gradually taper down to a lower maintenance dose, sometimes even every other day, based on how the pet responds.
Okay. Oral steroids. Any other way to give them?
Yes, and this is becoming increasingly popular. Inhaled corticosteroids. Drugs like fluticasone or budesonide, these are given using a special spacer device with a face mask, like the AeroDog or AeroCat.
Inhaled steroids. What's the advantage there?
The big advantage is that the medication goes directly into the lungs where it's needed, so you get good anti-inflammatory effects locally, but with much less absorption into the rest of the body. This significantly reduces the risk of systemic side effects that can come with long-term oral steroid use.
That sounds like a great option. Any downsides?
The main things are cost, getting the pet used to the mask, and the fact that we're still refining the optimal dosing protocols for inhaled steroids in veterinary patients. But for many, it's a very effective approach.
Okay. What about bronchodilators? Drugs to open the airways. Do they help?
They are frequently prescribed, yes. Although the evidence for their long-term benefit in every case of pure chronic bronchitis isn't always crystal clear, they can offer some helpful effects and are often used as part of the overall plan.
What kind of effects?
Well, drugs like theophylline can help relax the smooth muscle around the airways, leading to bronchodilation or opening of the airways. It might also help improve mucus clearance, strengthen the diaphragm muscle, which helps with breathing, and potentially lower that pulmonary artery pressure. Sustained release versions are usually preferred for more consistent levels.
Theophylline. Okay.
Any others?
Yeah, the other main class are beta agonists, like terbutaline or albuterol. These also cause bronchodilation. They can be given orally or perhaps more commonly for quick relief via inhalation, using that same spacer and mask system.
Inhaled bronchodilators, too. Yes. Inhaled albuterol, for example, works very quickly, but its effect doesn't last as long. It can be great for managing acute flare-ups or providing relief before exercise, but it's not usually the go-to for long-term daily maintenance control compared to steroids.
Got it. Steroids for long-term inflammation, bronchodilators, maybe for airway opening. What about antibiotics? When do they come into play?
Antibiotics are really only indicated if there's concrete evidence, or at least a very strong suspicion, of a secondary bacterial infection contributing to the problem.
So not used routinely.
No, definitely not. Remember that inflammation isn't always caused by infection. Ideally, the choice of antibiotics should be based on culture and sensitivity results from that lower airway sample, the BAL fluid.
Right. Target the specific bacteria?
Exactly. Yeah. But if those results aren't available yet, or sampling wasn't possible, the vet might choose a broad-spectrum antibiotic empirically. They'll look for one that's likely to work against common respiratory bacteria, penetrates well into lung tissue, is bactericidal, kills bacteria, rather than just bacteriostatic, stops them multiplying, and has a good safety profile.
Any examples?
Common choices might include drugs like trimethoprim sulfa, amoxicillin clavulinate, or sometimes a fluoroquinolone like enrofloxacin. If mycoplasma is suspected, doxycycline or chloramphenicol might be used. And if aspiration pneumonia or severe dental disease is part of the picture, they'll choose something with good coverage against anaerobic and gram-positive bacteria too.
Okay, antibiotics only when needed and ideally guided by tests. Now, what about drugs just to stop the cough itself, cough suppressants?
Antitussives, yes. They have a role, but it's quite specific. They are typically reserved for dogs with a really harsh, dry, non-productive cough that's severe, maybe interfering with rest or associated with airway collapse.
So not for every cough.
No, definitely not. And critically, they should generally only be used after the underlying airway inflammation has been addressed and controlled with corticosteroids. Suppressing a productive cough that's trying to clear mucus isn't usually a good idea.
Right, let them clear the gunk if they can. What drugs are used?
Prescription options for dogs include medications like butorphanol, hydrocodone, or codeine. Over-the-counter cough suppressants made for humans are generally not very effective and sometimes contain ingredients that are toxic to pets, so they should be avoided unless specifically recommended by a vet.
Good warning. Avoid human cough meds. Are there any medications that should definitely be avoided in pets with chronic bronchitis?
Yes, a couple are important to mention. Diuretics, especially loop diuretics like furosemide, often sold as Lasix, should generally be avoided unless there's a concurrent condition like heart failure that requires them,
Why avoid diuretics?
because they can dehydrate the patient and thicken the respiratory secretions, making them even harder to clear. The same goes for the anticholinergic drug atropine. It can also dry out secretions.
Okay, avoid drying agents. What about side effects or interactions with the common medications? Anything owners should watch for?
Yes, definitely. With the beta-agonist bronchodilators like terbutaline and albuterol, potential side effects can include a fast heart rate, nervousness or hyperexcitability, and muscle tremors. These are often dose-related and might lessen over time.
Okay, and theophylline.
Theophylline can cause similar side effects: excitement, restlessness, rapid heart rate, but also potentially vomiting or diarrhea. Because absorption and metabolism can vary, especially with generic products, sometimes monitoring blood levels of theophylline is recommended to ensure it's in the safe and effective range.
Monitoring blood levels. Okay. Any drug interactions?
Yes, that's important too. For example, certain antibiotics, like the fluoroquinolones or ampoule or floxacin, can actually slow down the metabolism of theophylline in dogs. This means that theophylline levels could build up higher than expected, increasing the risk of side effects. So it's crucial that your vet knows all medications and supplements your pet is taking.
Good point. Full disclosure to the vet. You mentioned inhaled steroids as an alternative way to give them. Are there any other alternative types of medications sometimes considered?
Well, the use of those metered dose inhalers, MDIs, with steroids like fluticasone or butzenide, delivered via the spacer and mask, is probably the main alternative delivery method gaining traction. As for other drugs, there isn't strong evidence right now to support using medications like cyclosporine, which is an immunosuppressant, for routine management of chronic bronchitis in most cases. The focus remains primarily on corticosteroids and sometimes bronchodilators.
Okay, so sticking with the mainstays generally. Once a pet starts treatment, what does the follow-up and monitoring involve?
Regular follow-up visits with the vet are really essential. They need to monitor how the pet is responding to the treatment plan.
What do they check?
They'll repeat parts of the physical exam, listening to the lungs, checking the heart rate, assessing breathing effort, asking the owner about cough frequency and severity at home. They'll track the pet's weight, especially if weight loss is a goal, And they might repeat some diagnostic tests periodically, like chest x-rays or maybe blood gas analysis, to objectively assess if things are improving or stable.
So, ongoing assessment.
Yes. And a big part of follow-up is also reinforcing prevention strategies, continuing to avoid those inhaled irritants, maintaining that ideal body weight, keeping up with dental care. It's about preventing flare-ups as much as possible.
Right. Proactive management. Are there potential complications we need to be aware of down the road?
Yes, unfortunately, several complications can occur, especially if the condition isn't well managed or is very severe. We've mentioned syncope, the fainting spells, which seem more common in small breed dogs with severe coughing.
Yep.
Pulmonary hypertension and its consequence, called pulmonal, right heart enlargement failure, are serious potential long-term complications from the chronic strain on the heart and lungs.
Right, the heart issues.
And over time, the chronic inflammation can lead to those permanent structural changes like bronchiectasis, the irreversible widening and distortion of airways, and more general airway remodeling, meaning the airway walls become thickened and scarred. These changes make the lungs less efficient and more prone to infection.
So the disease can cause further damage over time. What's the typical long-term course? What's the prognosis generally like?
Chronic bronchitis is, by definition, chronic and typically progressive. This means the underlying changes in the airways tend to slowly worsen over time in many patients, even with treatment.
Progressive. Okay.
Pets will likely continue to have some degree of coughing, though hopefully much less severe with management. They may experience recurring episodes or flare-ups of coughing and breathing difficulty. We can see the development of those complications like fainting, chronic low oxygen levels, hypoxemia, right heart enlargement, and pulmonary hypertension over months or years.
And flare-ups are common.
Yes, acute flare-ups are pretty common. They can be triggered by things like seasonal changes, pollen, humidity, changes in air quality, smoke, dust, worsening of the underlying inflammation, or the development of secondary bacterial infections.
So it requires ongoing vigilance.
Absolutely. So while we can often manage the symptoms very effectively and give these pets a good quality of life for a long time, it's crucial for owners to understand that it's usually a condition requiring lifelong attention and partnership with their vet. The prognosis varies depending on severity, response to treatment, and development of complications.
Okay, so pulling it all together on treatment, it really is a multi-pronged strategy, isn't it? It's about calming that inflammation, managing symptoms like the cough, maybe opening airways, tackling infections if they happen, addressing risk factors like weight and environment, all while accepting this as chronic, something to manage, not necessarily eliminate.
That sums it up perfectly. It's a comprehensive, long-term management plan tailored to the individual pet, with the ultimate goal of helping them live as comfortably and actively as possible for as long as possible.
This has been incredibly informative, a really deep dive into chronic bronchitis. It's just amazing how complex something that starts as just a cough can actually be.
It really is. And I think understanding that progressive nature and the absolute importance of consistent, proactive, long-term management, that's probably the most critical message for pet owners facing this diagnosis.
Definitely. And thinking about those environmental factors, even dental health, it makes you wonder, what small changes could maybe you, the listener, explore at home to support your pet's respiratory health, even if they don't have a chronic cough right now? Something to think about.
That's a fantastic takeaway. Thinking proactively about air quality inside the home, maybe it's changing furnace filters more often, ditching the scented plug-ins, looking into an air purifier, and definitely keeping up with regular vet checkups and good dental care. These things can have benefits far beyond just preventing bronchitis.
Excellent points. Well, thank you so much for sharing all this expertise and taking this deep dive with us today. It's really shed a lot of light on a condition that affects so many pets.
My pleasure. Happy to help clarify things.
And thank you, our listener, for joining us as we explored the ins and outs of chronic bronchitis in dogs and cats. If you have more questions or ideas for future topics you'd like us to tackle, please do let us know. We'd love to hear from you.